My name is Todd Combs. I am Associate Director of Research at the Center for Public Health System Science at the Brown School at Washington University in St. Louis and part of the Tobacco Town, Minnesota team. This project is a collaboration between the Public Health Law Center, the Center for Public Health System Science at the Brown School at Washington University in St. Louis, and the Center for Social Dynamics and Policy at the Brookings Institution. And the study was generously funded from ClearWay Minnesota. So today I will be talking about our project aims, giving an overview of the project, and then presenting some of the key results from the menthol policy simulations, as well as the retailer density policy simulations, talking about some key takeaways, and then walking through the dissemination strategies and giving a preview of our interactive dashboard. So Tobacco Town, Minnesota is a computational modeling project. And what that means is that we create a program to simulate policy implementation in virtual communities that look much like various Minnesota communities. And our goal in this project was to complement existing efforts going on right now in Minnesota, passing tobacco retail policies in efforts to change the retailer landscape. And we focused in on some of the most popular and most important policies currently for Minnesota, and those included menthol sales restrictions and retailer density reduction strategies. And after we virtually implement these policies, we measure the outcomes of changes in retailer densities, the total cost incurred to purchase cigarettes, and increases in the distance necessary to travel to buy cigarettes. And we measure these outcomes overall for all smokers in different Minnesota communities, and then we isolate the impacts for priority populations in Minnesota. And our goal is to widely disseminate these results for stakeholders in Minnesota as well as across the country. So the specific policies we tested in Tobacco Town, Minnesota had the aims of limiting the types of stores in which menthol or all tobacco products could be sold. For example, limiting all tobacco sales to tobacco specialty shops. And then we have these policies that we call proximity buffers, which establish a minimum distance between retailers. Say, for example, a new tobacco retailer cannot open within 2,000 feet of an existing one. And we also tested the impacts of limiting how close retailers can be to other landmarks like schools or parks. And an example of that would be that tobacco retailers can't operate within 1,500 feet of a school, or that menthols can't be sold within 1,500 feet of a school. So agent-based modeling is relatively new to public health and specifically tobacco control. And to our knowledge, we don't know of any agent-based models out there that are testing these relatively new retail-focused tobacco control policies. And in an agent-based model, we build an artificial society of individuals, and those are where we get the term agents. And we put them in a spatial and or social environment, meaning mimicking geography, street grids, things like that, and then agents moving around the space, the geography together. And then we create rules for how agents make decisions, and for these we inform it with mainly economics literature on decision making. And we don't just make up sort of the data, all of the data that we put in the model. We inform the model with empirical data and evidence from the tobacco control literature. So for Minnesota, we wanted to get the typical or average community for 6 different types of communities, and based on how urban those communities are or rural, and the median income of those communities. So we have 6 different types of communities specified, for example, as urban high income or rural low income, suburban high income, etc. And to choose these communities, we, as you can see on the map, took out all of the census places in Minnesota and tried to choose the most representative sites, those that being the sites that were typical or average among, or for each of the 6 categories. And we also weighted our choices with proportion African American, so that we had enough representation of African Americans to model them virtually. And then we also looked at sort of the average densities of retailers and average prices of cigarettes in Minnesota from store surveillance data. And so here we see the tobacco retailer density, that's the stores per square mile that sells cigarettes in each of the 6 community types. And we also see the average pack prices for regular and menthol. For the densities, it's immediately apparent that urban low-income communities have more than double the density of any other type of communities. And then we see that suburban high-income and rural high-income have the lowest densities. For pack prices, we see that prices are more expensive in urban areas and least expensive in low-income suburban or rural areas. The agents have characteristics that we call attributes, and these affect agent behaviors, how they make decisions. And we also, along these attributes, can disaggregate the outcomes to pull out those results for priority populations or particular community types. And we have up to 8 different agent types, depending on how much data we had to inform the model from. And the 2x2 table for LGBT status and African American shows that where data were available, we informed the model and created the agents along these 8 typologies. One, for example, being low income African American non-LGBT. So we have 4 basic types of agents: non-LGBT, LGBT, African American, and non-African American. And then we split those each into 2 for high and low income. And we did this because the tobacco control literature, in the tobacco control literature, we know that African Americans have higher rates of smoking, LGBT are more likely to smoke, and lower income households have higher smoking rates than higher earning ones. So basically in the model, each day, the agents travel between work and home along set routes in the built environment, the geography of the town, that is. And agents have a constant daily smoking rate. Cigarettes per day is how it's measured in surveys. And then the key action that goes on in the model is a tobacco purchase. Agents decide whether to purchase cigarettes and then decide where to purchase them based on price and proximity, how close they are, and the agent attributes, income, LGBT status, etc. And so here's a little more on the decision making. They decide, like I said, whether and where to purchase. And these purchase decisions are based on agent attributes. We also have different price sensitivities from the tobacco control literature for the different agent types, so that if prices increase or costs increase due to implementing a density policy, say, some agents might choose to go somewhere else or not buy cigarettes if the increase is too high. And agents make these decisions at the end of the day by minimizing the total purchase cost, and that's the price of the cigarettes plus the time and distance it takes to get to the retailer. And we sometimes call those the indirect costs or the opportunity costs of purchasing cigarettes. And the time, how we sort of monetize the time, we do that by the agent's wages, and the wages are informed through census data. Here is a little video of the actual program running, and the grids represents the streets in either of the communities, and the dots moving around on the streets represent the agents. So you see there are many, many of those. The differently colored squares represent tobacco retailers, and each time there is a yellow flash, the tobacco purchase is being performed. And so the model runs for a virtual 3 months, that's 90 days, and then with all of the policy tests and the 6 different types of communities, ends up in over almost 6,000 model runs and over 80 gigabytes of data to analyze. So now we'll have an overview of some of the results, and we'll start with the menthol policies. The 4 menthol policies that we are presenting today include, from the top to the bottom, restricting menthol sales to tobacco specialty shops, combined with a retailer-to-retailer proximity buffer of 2,000 feet. That means that retailers can't be within 2,000 feet of one another. And then with that same policy with a smaller buffer of 1,000 feet, and then the sales restriction of menthols to tobacco shops alone. And then one of those geographic menthol buffers wherein menthols can't be sold within 1,500 feet of other landmarks like schools or parks or churches. And here the results are broken down by community type. And we see that the menthol sales restricted to tobacco shops plus the 2,000-foot buffer shows that highest potential percent change in total costs. That is the price of cigarettes plus the travel costs or opportunity costs of purchasing them. And so we think that this is potentially one of the strongest policy combinations for driving up those costs of acquiring menthol. And we see that in the high income communities, the bottom row of the graphs, we see about 10 to 12% increase depending on what type of community. And then we see the largest increase in total cost for suburban low income communities. And then we see the lowest for urban low income communities at about 8%. And that is due to that much higher retailer density in urban, low-income urban communities. Next, we'll look at the increase in the distance necessary to travel after each of these policies. And here again, these same 4 policies are from top to bottom ordered in the potential impact that they have. And we see that for that same strong policy combination of the 2,000-foot proximity buffer between retailers and restricting menthol sales to tobacco shops has the highest potential impact across community types. The other things that we can see here are that this geographic menthol buffer that is 1,500 feet from other landmarks like schools has the lowest impact across communities, And the highest increase in distance, or the biggest change, would be in urban low-income communities where in Minnesota, we estimated that there's about a half a mile of travel distance at baseline, that is before the policy is implemented, and then an increase to 2 miles after the policy is implemented, because menthols have less availability and people have to go to certain stores and travel further to get there. And everywhere except urban low-income communities, we see that the impact of the menthol sales restriction to tobacco shops with a 2,000-foot buffer, a 1,000-foot buffer, or without a buffer is about the same for all other 5 types of communities. But we do see an increase in the potential impact for urban low income. We also think that having a buffer paired with one of these menthol policies or any of the other policies can help sort of guard against future tobacco shops opening or other retailers opening, because the 2,000-foot buffer is in place. So here we have the same 4 policies results, and they're now broken down by priority populations. Clockwise from top left, we have overall, that's for all smokers, and then Black or African American smokers, and then low income smokers, that's less than $35,000 in wages a year, and then LGBTQ plus smokers. And here we see sort of the same results. The policies are still from top to bottom, from highest to lowest impact. See the lowest impact in the geographic menthol buffers and the highest impact in the menthol sales restrictions and the 2,000-foot retailer buffer. We also see that the largest impacts here are seen for LGBT smokers and in the overall population, with over 10% increase in the overall cost of cigarettes potentially. And then we see the lowest impacts, slightly lower, for lower income smokers. So they're for the strongest policy potentially increasing by a little over 7%. And now we see the same results broken down, or sorry, the results for distance for the same priority populations. And if we look at, or if we think about why the low income smokers see the lowest, that 8%, 7 or 8% increase for the menthol sales restriction to tobacco shops and the 2,000-foot buffer, we see that low income smokers are generally traveling farther, or the farthest, at baseline, before policies are implemented. And so they're already traveling farther for lower prices. And so the increased time and distance it takes is lesser for low income smokers than it is for all other groups. We also see that African Americans are traveling the shortest distances at baseline before policy implementation, and that the increase for African Americans is the greatest, especially with that strongest policy on top. So next, we will talk about the results of the retailer density reduction policies. And we will start that off with percentage change in the total cost, that's travel plus price costs, for each of 6 chosen density policies. And the 6 policies that we'll talk about today are restricting all sales of tobacco products, that's menthol, regular, cigars, or everything, to tobacco specialty shops, plus adding in that 2,000-foot retailer to retailer buffer. Then we have restricting all tobacco sales to tobacco specialty shops on its own. We have a pharmacy sales restrictions, that's taking tobacco out of pharmacies, plus a 2,000-foot buffer. Then we have a 2,000-foot buffer on its own, a 1,000-foot buffer, and then just the pharmacy sales restriction by itself. Again, the policies are ordered from strongest potential impact to weakest, top to bottom. And here again, we see that restricting sales to tobacco specialty shops plus that 2,000-foot buffer sees the highest potential results in all communities. Other parallels with the menthol policy impacts are that the low-income urban communities see the lowest impacts, again, because of that much higher retailer density before policy implementation. And we see the highest impacts in the high income communities, where where the total cost could increase by a percentage of 10 or more, especially in urban high income areas. And then in suburban and rural low income areas, we see about a 7 to 10 or 11% potential increase. And then the potential increase for all the other policies, save restricting all tobacco sales to tobacco specialty shops on its own, are much less than that for the buffer, the 2,000-foot buffer and the specialty shop restriction. And again, here we see that with this tobacco specialty shop restriction, with or without the 2,000-foot buffer, has really similar potential impact, but we think that adding that buffer can help in the future. And here we see the increased average distance necessary to travel to purchase cigarettes after policy implementation for each of the 6 policies. And again, we see the largest impacts for those top 2 policies being in the high income communities, and then the lowest changes here are actually not for urban low income, but for rural low income. And that is because, you know, stores are fewer and farther between in rural areas, and smokers in those communities are already traveling the farthest distance to purchase cigarettes. But we are seeing that the distance doubles for all communities except for suburban and rural low income. So here we have the same policy, or the same policy results broken down by priority population. Overall, Black or African American, low income, and LGBTQ plus populations. And again, we see, like the menthol results, we see that restricting sales of all tobacco products to tobacco specialty shops and adding in that 2,000-foot buffer has the largest potential impact on cost. Here again, if in the lower right-hand corner, we see that low-income smokers have the we'll see the lowest potential increase in cost because they're already traveling farther to get lower prices. And we see that compared to the top 2 policies, all of the other results are much less. And finally, we have the increased distance necessary to travel broken down by priority population for the 6 density policies. Excuse me. And here we see that the highest impact or the greatest change is for African American smokers for those top 2 policies. And we see that the lowest potential impact is for low income smokers for the top 2 policies. Here again, that we believe is because lower income smokers are traveling farther to begin with. And so the increased distance is not as much for them as it is for everyone else. But we also see some equity here, if we can think of it like that, in that everyone, at least for the top 2 policies, all groups are traveling approximately the same distance, potentially, to purchase cigarettes. And all of these results are going to be included in the dashboard that I'm going to show you just a little bit later. And so you can go in there and interact with these graphs, choose the policies you want, and then download them to keep. Some of the key takeaways we feel are most important is first, the importance of context. We see across the board that lower income communities have higher retailer densities from the start. And we also know that they have more priority populations than wealthier communities. And that we see that the impact, or the potential impact of these policies really differs across communities. For either the menthol or the density reductions, low income areas see really good potential impacts community-wide for priority populations. So even though they're lower in some respects, they have higher percentages of priority populations and therefore might reap the greatest benefits. Another theme that we saw was that low income smokers, and relatively consistently so, see the smallest impacts because they're already traveling farther. So policies aimed at reducing smoking in low income populations need to take that into account when you're considering retail policies. We also see that those buffer policies have the highest potential impacts in more densely populated areas than those that with less population, because with more population density comes higher retailer density as well. The strongest single policy potential impacts were restricting sales, whether it be menthol or all tobacco products, to tobacco shops. And then the strongest combination is adding that 2,000-foot buffer to that sales restriction. And of course, that stronger policies, for example, a 2,000-foot versus a 1,000-foot buffer, have higher impacts than weaker ones do. Another advantage of agent-based modeling is that it can uncover gaps in data collection and existing data that we have. And so while we found that one of the most useful things in testing the potential impacts of menthol policies was having surveillance data that measured menthol use beyond, do you smoke menthol, yes or no? And the National American Tobacco Survey broke it down into always, mostly, sometimes, rarely, and never. And here we've combined those middle categories to one, and we see that 1/3 of smokers in every case, except for African American, that is, are in that middle ground. And so if we're only asking smokers whether or not they smoke menthol, yes or no, we are potentially overestimating the impact of menthol policies, or underestimating them in some cases for some priority populations and communities. And now that the NATS, that survey, has been discontinued by the CDC, we really want to put the word out there to stakeholders and leaders of these surveillance and instruments to rethink how they're asking about menthol, because with the new focus on menthol policies, we feel that this could have a big impact on policy choice and the subsequent results from the policy. We have many ways that we are disseminating the results of this study. What I will show you in just a minute is our online interactive dashboard. It is not finalized yet, but will be by the end of 2018, and we plan to have the link on the Public Health Law Center website, as well as the Center for Public Health System Science website. and perhaps other places. And then we are creating at least 3 policy briefs, and these are maybe 1.5 page, really focused reports of specific findings, like the strongest policy or the highest disparity reducing potential policies. We're preparing an executive summary, and this is just a brief report of all the key takeaways and results. We are almost finished drafting an academic paper that should be published in 2019. We have done 3 or 4 conference presentations and 3 or 4 webinars so far, and many of those have been recorded. At least one of those has been recorded and will be on the Public Health Law Center website. And so now I would like to show you, just to give you a brief overview and introduction of the dashboard that will be up and running and available to the public by the end of 2018. So here it is, the Tobacco Town, Minnesota dashboard. And if you look across the top, you see that we have the results from the menthol policies, the results from the density policies, and then a couple of other tabs. So I'm just going to look at a few of these pages really quickly. From each of these, there's a drop-down menu. We can see the impact on cost here of restricting menthol products. And here's a graph very similar to the one that I presented to you in the webinar. And the cool thing about the dashboard is that if you just want to look at policies for low income areas, you can just choose those. And here we're just comparing the potential impacts in low income communities. And then you can download that plot. And it should look something like this. The same for density. This grid sort of mocks up the densities before and after policies down the side here in each row, and then each column represents a different type of community, and we see right away that there are many, many more retailers in urban low-income areas than anywhere else. We can also look at the priority populations results. These are the cost results. You can go over here and toggle between cost and distance. And then, of course, download any of those plots you want. You can get more information about the types of communities and sort of their priority population proportions, pack prices, etc. You can view the video of the actual model, get a little more information about how we built it. We also have a we also have a map that we are adding policies to all the time. We have about half a dozen so far. We have a couple more to add currently, but you can see current policy activity in Minnesota related to our model. So if you click on a dot, here we see that Glendon in January of 2016 put one of those retailer buffers for schools and parks and other places. Whoops. And then if you want to see the actual policy language, you can click on View Policy, and that will take you out of the dashboard to the actual policy language, which could be helpful for other communities. And then this page is not finished yet, but we have some additional resources that you can download that are, more background information on these types of policies. We'll have all the policy briefs. We'll have this webinar and any other resources that we can put on here on the dashboard. And then finally, you can learn just a little bit more about our team and the project. So that is it, and thank you.